Today, Fairfax County is participating in a National Capital Region-wide exercise called Capital Fortitude. This is a 3-day exercise that tests how jurisdictions throughout the National Capital Region dispense life-saving medication during a public health emergency. The scenario that we would open up a dispensing site like this is one in which bioterrorism weapons such as anthrax were somehow released into our community.
If that were to happen, it would require that all 1.2 million people in Fairfax County receive life-saving medications very quickly.
So we open up points of dispensing in Fairfax County. There are locations around the county and around the National Capital Region that community members can come and receive medication. Fairfax County Health Department does these exercises about every year. So the dispensing sites themselves, while very challenging to pull off, are generally something we prepare for and exercise pretty regularly. One of the big reasons we do exercises like this is to provide our staff and our Medical Reserve Corps volunteers an opportunity to really test in a real-world situation all of these plans and these responses that they're trained for. They get to lay their hands on it and actually do it. And that's helpful from a training perspective for our staff and volunteers. It's also helpful to put the plans to the test. You know, we can sit in rooms and we write plans and that's very good and that's helpful, but we don't know if the plans are going to work until we actually come out and do it in the community.
This is our goal, that when the doors open, that this will be the calm that people see. Because already the news about why people need medicine is going to cause anxiety amongst our residents. And coming here, I'm sure that people might be imagining the worst. We want them to have this kind of surprise, which is, oh, it's not so bad. Things are moving orderly. They know what they're doing, that we're helpful, we're answering questions, we're allaying concerns, and people are feeling better as a result of having been here. That's our goal. So what you see today is what I hope will happen, and I think will happen because of the time we have invested as an organization, as a county, in preparing for this very scenario, so our residents will have a good experience in a very challenging time.
Our business is to be prepared for the worst case scenario, and that's why we do these things.